Okay, so we're going to go over flossing technique. The key with flossing is to be very careful, to take your time, and to make sure that you get in between all of the teeth. Most people rush through it. Most people don't push their floss down in between the teeth far enough to get below the gum line. And so it can be ineffective if you're not being careful. We're going to use traditional floss because for orthodontic patients, you have to use traditional floss in order to get underneath the wire. This patient does not have braces on yet, but for my patients who are getting ready to start orthodontic treatment, I always teach flossing instruction with traditional floss, so that way they'll be ready when the time comes. So, step one is to make sure that you have enough floss, okay? I want you to make sure you're paying attention, okay? You should get about 12 to 18 inches of floss. If you don't have enough floss, then it makes it difficult for you to effectively floss. This is probably closer to 2 feet, so it might be a little longer than we need, but that's okay. You take the floss with your middle finger and thumb of each hand, and then you wind the floss 3 times around each middle finger. And then, whether you're right-handed or left-handed, basically you're going to have one hand, which is going to be your extra floss, your spool, and then another hand, which is going to be your dirty side. You're going to have a clean side and a dirty side. So I'm right-handed, so I'm going to put the clean side on my left hand. So I'm going to wind the floss up until I have about 4 inches left on my left. It's wound up. On my right, I don't have anything but the first 3 winds around my finger. So what's going to happen is each time we floss, we're going to get a little bit of plaque on the teeth. And so if there's so much that you needed a clean piece of floss, then you wind it with the right, then the dirty side is going to go closer to your right hand, and you unwind with the left, and now you have a brand new fresh piece of floss there to work with, okay? So, because it's wound around your middle fingers, the fingers and thumbs that you're going to use to direct the floss are your index fingers and your thumbs. So a good thing to kind of remember is you should be able to make 2 pistols with your hands. So your pinky, ring finger, and middle finger can be balled up like a fist, and your index fingers and your thumbs are free. That allows you to guide the floss with either the thumbs or the index fingers, or a combination of the 2, okay? Another thing to keep in mind, to pay close attention to, is notice how close my index fingers are together, okay? Teeth are small. Nobody has a tooth that's this wide. So there's no reason for you to be flossing with your hands that far apart. When you guide the floss in between the teeth, your fingers should be really close together, so that basically your fingers are, one finger is going to be on the inside of the teeth and one finger is going to be on the outside of the teeth. And they should, that's as much floss as you need to work with, okay? So, open wide for me, please. We're going to start right in the middle on the bottom, and try to smile a little bit so we can see all your teeth, and open a little bit more. That's good. Okay, so what we're going to do is we're going to take our index fingers, and like I said, we're going to keep them close together, and we're going to push the floss down in between the teeth. And notice already that the floss is starting to go below the gum line. We can't see all of the floss right now. That's where you want to floss. We're not flossing up here on the teeth. We're flossing below the gum line where the toothbrush can't get, because that's where the plaque likes to hide. And for this patient, we're teaching her how to floss. She's never been taught how to floss, so she hasn't been doing as good of a job of flossing as she will now. But we can see how inflamed and swollen that gum tissue is. You can see that when I push the floss down, there's a little bit of hemorrhage, a little bit of blood. That's because that tissue is very inflamed and swollen. If she flosses once a day for the next week, then number 1, the tissue won't be as swollen, and number 2, she won't see any swelling or any bleeding. Now, it's also going to be a little bit tender for her. You can see how she's kind of running away. She's pushing her lip up towards my fingers, and she's trying to close her mouth a little bit. That's because the gum tissue is a little inflamed and tender. So, and it probably feels weird because the floss is going down below the gum line. If she flosses every night for the next week, all of that's going to change. It's not going to be as tender, she's not going to see the bleeding, and the gum tissue is not going to be as swollen. So a couple things. Notice how, number one, when I first started, I was using my index fingers, but then I switched while I was talking, and I've got a thumb on my left, and I've got an index finger on my right. But anytime you floss in between two teeth, that means you have to floss two teeth, okay? So notice how the floss is wrapped around the tooth in a C shape, okay? That's what we want to do. We're going to floss up and down into the gum line, okay? It's going to be okay. I know it's a little tender, but try to relax your lip. We're going to floss up and down into the gum line, just like this, okay? And you just got to do it 2 or 3 times, and then you're done with that side. Then I took the floss out, but you don't even need to do that. You don't even have to take the floss out. Once you floss on that side, then you just flip to the other side, and notice how we made a C shape around the other tooth, okay? Go floss down into the gum line, pull the floss back up, and then you're good to go. Now, there isn't a lot of plaque on this floss, but there's a little bit of blood. So if you want a clean piece of floss, you wind up on the right, unwind on the left. Now we have clean floss to work with. So now we can go back to the next set of teeth. Open wide for me. Gonna go down below the gum line, okay? Floss all the way down, and then do the exact same thing on the tooth next to it, okay? We've done that 3 times. Now we've flossed those teeth, so that area is good to go, okay? Now, another thing to notice, we're not sawing the gum tissue. We're not flossing back and forth like this, okay? And also, remember I said we're not keeping our hands really far apart. We're not using the floss, we're not flossing like this, with one hand way in the mouth and the other hand way out the mouth. We're guiding the floss directly around where the teeth are, like this. That's gonna give you the most control. That's gonna allow you to floss the most effectively, most easily, and quickly. So now you can watch how quickly I can go around the entire mouth and floss like this. Open for me. Again, see how the floss kind of hides? It disappears below the gum line. We're not cutting into the gums. That's not what you're seeing. There's a pocket there of space between the gum tissue and the tooth, and that's where we need the floss to go. That's the area that hasn't been being cleaned properly. Okay? And we would do that all the way to the back of the mouth and wide forward. If you have to reach further back, then sometimes, I was using about 3 inches to go in between the teeth just now. But if you have to reach further back, then give yourself 4 inches. That gives you a little bit more room to work with. Open wide. Okay, so same thing. Push down into the gum tissue. Come back up. Okay? That's it. It's that simple.